Welcome to the Medi-Cal Managed Care 101 series. This module is designed for organizations who are considering becoming providers of enhanced care management, also known as ECM, or for those who have recently entered into contracts to become ECM providers. In this video, we will outline some of the basic requirements your organization must meet in order to qualify as an ECM provider. And after that, we will review the core service components that your organization must deliver as an ECM provider. And we will close then with select partnership requirements that we have heard from provider organizations as important to have in mind at the outset. Please note that this is an introductory level series, so we will give you an overview of the requirements rather than an exhaustive list. After orienting to the module, your managed care plan will be able to give you more information. If you're gearing up to become an enhanced care management provider, it's crucial to understand the foundational requirements that ensure you can offer top-notch care. Here's a breakdown of what you'll need to bring to the table. First, know your audience. You've got to have solid experience with the populations you plan to serve. This isn't just about knowing their names, it's about understanding their unique needs and challenges deeply. Next, skill in your services. It's one thing to offer services, it's another to excel at them. Make sure you're not just familiar, but highly skilled in the specific services you provide. This expertise ensures you deliver impactful and effective care. Next, stick to the rules. Complying with state and federal laws and the specific ECM program requirements is critical. This includes following all the guidelines laid out in the DHCS Managed Care Plan, ECM, and Community Supports contract, and any related guidance documents. Next, cultural and timely care. The care you provide needs to be culturally appropriate and timely. Whether it's making house calls or accompanying members to important appointments, being there physically and understanding their cultural context is key. As is communication. You need to be able to chat with your members in a way that's both culturally sensitive and easy for them to understand. Ensuring everyone is on the same page is vital for effective care management. Next is teamwork across the board. Collaboration is non-negotiable. You should have solid agreements in place with local healthcare providers like hospitals, primary care practices, and specialists. This network ensures that the care is seamlessly coordinated and comprehensive. Next is tech-savvy documentation. Your documentation game needs to be strong. Use a system that can integrate data from various sources: physical, behavioral, social services, administrative. This helps in creating and managing detailed care plans that are accessible to all parties involved in members' care. This is just an overview of the basic requirements. The official standard terms and conditions document outlines everything in detail, so we encourage you to review it if you haven't already. So let's now do a deep dive into the core service components for ECM providers. Beyond meeting the basic qualifications, as an ECM provider, you'll need a robust set of skills and experience in specific core service components that are essential for delivering high-quality care. Let's explore these components and understand why each is crucial for your role. The first component is outreach and engagement. Your job starts with making connections. Whether it's through in-person visits, mail, phone calls, or community outreach, your ability to reach out and engage with members is fundamental. This first step is about building trust and laying the groundwork for effective communication. The next core services component is a comprehensive assessment and care management plan. This component involves a thorough assessment of both the clinical and non-clinical needs of each member. You'll evaluate their overall situation and then develop a care management plan tailored to their individual progress and changes. This personalized plan is pivotal in guiding the ongoing management of their health and wellness. Next is enhanced coordination of care. Providing care means more than just occasional check-ins. This involves intensive, often in-person interactions with a member and their support network, including family members, guardians, or caregivers. Your role here is to ensure that all aspects of the member's care are seamlessly integrated and that everyone involved is on the same page. The fourth core services component is health promotion services. Here, you'll work to motivate members to make healthier lifestyle choices. Whether it's through education, support groups, or individual counseling, your goal is to empower members to take an active role in managing their health. Number 5 is comprehensive transitional care services. Transition times, such as discharging from a hospital, are critical. You'll ensure that the member has the support they need to make these transitions smoothly, reducing the risk of complications and ensuring continuity of care. The sixth core services component is member and family supports. Supporting members means also engaging their families or other caregivers. You'll provide them with the necessary information and the tools to understand and manage the member's conditions effectively, which is key to improving treatment adherence and overall health outcomes. Finally, the last core services component is coordination and referral to community and social support services. You'll need to navigate and coordinate additional services that address the broader social determinants of health, such as housing, employment, and education. Determining and linking appropriate services ensures that members' needs are met comprehensively, beyond just the medical aspects. So it's also crucial to understand some additional requirements that are intended to be supportive of the partnership between provider organizations like yours and the managed care plan. First, we have the data sharing requirements set forth by DHCS. These guidelines are designed to ensure that all parties, your organization, the managed care plans, and other providers, can effectively exchange information about members. So why is data standardization important? First and foremost, we need to make sure that the data flowing to community supports providers like yourselves is complete and robust enough to support effective care management. This means having access to all the information necessary to make informed decisions about a member's care. It also helps managed care plans prioritize the information that they truly need. This streamlines the process, making it easier for everyone involved to access key data points without getting bogged down in unnecessary details. Especially in counties where there is more than one managed care plan, standardization minimizes the headache of having to provide different data sets for different plans. This consistency saves time and reduces errors, making your life a little bit easier. So what does this mean in practice? Well, the data guidance covers 4 types of files you may be working with, each defined with a, quote, minimum necessary, end quote, data set. This includes essential information like the member's name, date of birth, and lead care manager's name. Just the basics needed to ensure everyone is on the same page. It also outlines how this information should be shared using standard file formats like Excel and suggests how frequently you should be updating and sharing this data. This helps maintain a steady flow of current and useful information. So what about reporting requirements? Here's something to keep in mind. Managed care plans can't just pile on more reporting requirements than what's officially listed as required and mandatory. Any additional reporting can only be implemented if both you as a provider and the managed care plan agree to it. This mutual agreement clause is crucial. It ensures that both parties are on the same page and that the additional data collection is truly beneficial. And lastly, we need to talk about enrollment minimums. Many managed care plans specify minimum enrollment numbers that providers must meet to qualify for a contract. These numbers ensure that providers have the sufficient scale to deliver effective services, but can pose a challenge for smaller organizations. If your organization is on the smaller side, knowing these figures up front helps you assess your capacity to meet such requirements. And if you're ever feeling overwhelmed by these requirements, remember, you're not alone. The data guidance is there to help simplify your processes, and if you need more help, the TA Marketplace is a great resource for finding support at no cost to you. Make sure to review the specific data guidance documents linked in our resources, and don't hesitate to reach out to your managed care plan for further clarification. They're as invested in making this work as you are. Here are some actions you can take to learn more. Review the ECM and Community Support standard provider terms and conditions linked in our resources. Check the CalAIM data guidance for detailed information on data sharing requirements. Check out the trainings and tutorials on your managed care plan's CalAIM website. This is extremely important because there may be differences between managed care plan requirements and processes, so you'll always want to refer to the information presented by the managed care plan you will be working with. Thank you again for joining us. Please be sure to watch the next video in the series, where we will outline the general process to deliver ECM services to Medi-Cal members.